Hello everyone, welcome back to Enamel Heroes. I hope you all are doing well. So today I'm here with a 1 month strategy to crack anatomy. Yes, you heard it right. We have 1 month strategy to prepare you for your professional exams. Okay, so the strategy is this basically strategy I have followed, and I also got reviews from the other students also, from the other people who followed this. So basically, what I have done here is I have designated certain topics to certain days, and now the task is for you to cover that particular topic on the same day. So, this is how you're going to complete your entire anatomy or revise your entire anatomy 1 month before your professional exam, and you'll be like pro. Like anatomy questions for you will be like a cakewalk. Okay, so let's see into the video what we have. So this is the last 1 month strategy to study anatomy as written in the picture. Okay, so these are the days that I have designated to certain topics. So what you have to do on day 1, you have to complete these topics. Triangles of the neck, only anterior triangle. Okay, then scalp. In scalp, what you have to study? Extend, layers, nerve supply, and the arterial supply. So you are good to go for day 1. So this is the part you have to cover on the day 1. Now let's see day 2. On day 2, what you have to do? Just put on some good music. Gana mana bajao. And what you have to do? You just have to draw the diagrams. Just put on some good music and draw the diagram of nerve supply of the face, arterial supply of the face, sensory innervation of the face, motor supply of the muscles, and venous drainage of the face. That's it. No difficulty, easy peasy lemon squeezy. You just have to cover these. And what you have to cover? Just draw the diagram, draw the well labeled diagram. That's it for the anatomy. So this much part you have to do for day 2. Okay, now let's see day 3. Day 3, you have to cover lacrimal apparatus and the posterior triangle of the neck. Okay, now let's come to day 4. On day 4, you have to cover norma frontalis, norma verticalis, norma occipitalis diagrams. Well labeled diagram, that's it. No text, nothing. In Viva, they ask you the difference between the male and the female skull. So you should know how you're going to differentiate. Okay. Mandible and its muscle attachment, only diagrams. A well labeled diagram. You don't have to study a lot of text. Anatomy is diagram, diagram is anatomy. This is the thing that you have to keep in your mind. Okay. Modulus, diagram. Bell's palsy. You need to know text. Which nerve is involved, what are the symptoms and everything. Okay, along with the diagram. So that's it for the day 4. Now for day 5, we have day 5, we have deep cervical fascia. It's layers. I have already made a video on deep cervical fascia. It's layered, so you can just go and check it out. Very thoroughly I have explained there, so you can just check it out. Dangerous areas of the face, diagram, well labeled diagram only. That's it. You're good to go for day 6. On day 6, you have to cover parotid gland. It comes in a long note. Okay, so just study it thoroughly. क्या क्या पढ़ना है इसमें now? You have to study its location, boundaries, extent, relations, nerve supply, vascular supply, and lymphatic drainage. That's it. Diagrams are well labeled diagrams, and your diagram will be covering the text. You don't have to study text alag se. Okay, now for day 7, you're going to study ansa cervicalis, muscle of mastication. In muscle of mastication, origin, insertion, nerve supply and action, and maxillary artery. I'll be going to make a video on maxillary artery separately. If you want, just comment down below. Okay. Now we have reached day 8. On day 8 is your rest day. You don't have to study anything new. Just you have to revise whatever you have studied till day 7. Just revise everything. You don't have to study anything new. Just relax. Just relax entire day and revise everything that you have studied till day 7. Okay. Now just charge yourself for next day, that is day 9. And now let's see what we're going to study for day 9. We're going to study only 2 things: submandibular gland and carotid triangle. I have made video on carotid triangle. You can go and check it out. Okay. I think it's there in posterior triangle. The topic is posterior triangle, or maybe in deep cervical fascia. I have made a video. Just go and check it out. In submandibular gland, extend blood supply and lymphatic drainage. Diagrams. Only well-labeled diagrams. If you know the well-labeled diagrams, you can extract text out of it. You don't have to study text separately. Okay. On day 10, TMJ, very important. It comes in a long note, and these are the things that you're supposed to cover when while you're studying TMJ. Okay. On day 11, you are going to study very important topic. That is okay. You're going to study thyroid gland along with its development. It is asked in it comes in long note, the development of thyroid gland, and these are the things that you're supposed to cover when you are studying thyroid gland. Okay. So day 11, only one topic, that is thyroid gland. That's it. You're good to go. Okay. On day 12, you have to cover tongue. Only one topic you have to cover, and inside the tongue, these are the things that you will be covering. Okay. Then day 13, you will be covering cranial nerves. 7th, 5th, vagus, and if you feel like covering one more, then you can cover vestibular cochlear. Otherwise, you can leave vestibular cochlear. But all these nerves are important. On day 14, you will be covering only 2 new topics, that is brachial plexus. इसमें भी सिर्फ diagram पढ़ना है, and Walde's ring, only diagram, and the revision. So this is also kind of a rest to you, or you will be revising the things that you have covered till day 13. Now day 15 and 16, what you have to do, put on some music, some good music, and just study the entire development. And also I'm going to tell you from where you're supposed to study. You're going to study this from pedo. From pedo, Nikhil Marwa, the author, the writer, very good diagrammatic presentation of the development. Only diagram, just put on some good music, watch your show, maybe on Netflix or wherever you feel like, and just draw the diagram, just practice the diagrams. So this is how you're going to complete your development part. Then we come to day 17, only 2 topics, ages of mandible. In ages of mandible, only diagram and the paranasal air sinuses. That's it. Then till here we are almost done with anatomy. Now in embryo section, these are the things that you're going to cover: oogenesis, diagram, spermatogenesis, what are neurocrest cells, notochord formation, and fats. That's it. Nothing more than that. This is the only topics that you're supposed to cover in embryo. That's it. Nothing more than that. Okay. Now we came to day 19. On day 19, you're going to cover pharyngeal arches, pouches, cleft lip, cleft palate. That's it. And in the histo section, you're also supposed to study histology. So these are the slides that you are only supposed to cover. You are not supposed to study the entire histology. Just cover parotid gland, transitional epithelium, stratified hyaline cartilage, elastic prostate gland, and the tiers of testes, ovaries, and fallopian tube. That's it. The slide, the diagrams of the slides. You are good to go with histo. You're not supposed to study the entire book. Okay. Now voila, we come to day 20, and this is your rest day. You can revise, you can do whatever you feel like. Now on day 21 and 22, same thing. Put on some good music and practice the diagrams, only diagrams. Nothing you have to learn. Just put on some good music and practice the diagram as much as you can. So that's it for day 21. And on day 22, these are certain short notes that may be asked, that can come in your theory exams also, in theory exam only, in fact. So you can just go through these short notes. So that's it. We have covered the entire anatomy, which includes both the embryology part also and the histopol part also. So that's it, my students. If you want to study anatomy in last 1 month, so these are the things. You can revise the entire anatomy in 1 month if you follow my rule. This is the strategy that I have followed, and I have also made other students also who follow this strategy, and the reviews are really nice. If you really want to score good and come up with flying colors in your anatomy theory exam, just follow the strategies, just follow the days, topics that are supposed to be covered on that day, and you're good to go. So that's it, my students. Thank you. Just let me know how this strategy is and how it is working for you. Okay, so thank you.